This meeting is being recorded.
All right. I'm going to call the Seneca Healthcare District Board meeting to order at 3:01. And let's see, we will be meeting in closed session pursuant to Government Code 54956.9D1, Government Code 54956.9D2, Health and Safety Code 32106. And I also wanted to make note that there's an agenda item clarification needed, that the public employee evaluation of the CEO is actually pursuant to Government Code Section 54957, not Health and Safety Code 32106. All right, and with that, let's make sure we know all of the board members who are present. And Dr. Walls is here. I am here. Rich, are you online?
I am.
And
Here.
Ken
Yes, I'm here.
and Ryan?
I'm here.
Thank you. All members are present. All right, let's go ahead and do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic which stands one nation, God, indivisible.
Indivisible, with liberty and justice for all.
Thank you. All right, now we go into our public comment period. Do you have any public comments, either online or submitted in advance?
We do not have any online or in advance. We do have a guest.
All right, hearing no comments, we'll move on. Next item is number 6, approval of our regular board meeting minutes. Has everyone had a chance to review them? Anyone have any comments?
Do you want a motion for both meetings?
Not yet. I did have a couple of edits for the regular minutes. I didn't know if anyone else had any other changes, but, so number 10, the special board meeting section. Deborah, if you wouldn't mind, we also had discussed that the board was informed legal counsel and advised that the design build contract could be considered and approved at a special meeting. So if we could please make that note of that in the minutes as well.
Okay, and this is for October 27th?
Yes, thank you.
Will do.
And it should be in the recording if you need.
Okay.
And then also for the financial report, unless we made an error, that motion should have been made to accept and not approve the financial report. And then under item to be added to the regular board meetings, this was my fault, I wasn't clear enough on this. December 1st should have been the informational for the board vacancy candidates to be considered at the December 29 meeting, and then December 29 needs to have an action item for candidates to be considered in a possible selection.
Noted.
Thank you very much. All right, and with that, does anyone else have any other comments or clarifications for either of the minutes? If not, then yes, Dr. Walls, I would accept the motion to approve both.
I will make a motion to approve the minutes from the November 14th meeting and the October 27th meeting.
Great, thank you. Do I have a second?
I'll second.
Thank you, Ken. All in favor, Dr. Walls?
Aye.
Ken?
Aye.
Ryan?
Aye.
Rich?
Aye.
And I'll vote aye. Thank you. Okay, so next item is our medical staff report. It looks like we don't have a report or any appointments to do for this month. Next is our policies and procedures. We are being asked to rescind elective outpatient procedure restrictions, finance 008.002. Anyone have any comments or questions on this one?
Why is that being done?
Has Chelsea on by chance?
Steve's on.
Steve? Thank you, Steve.
Dr. Walls, this came up during our annual review, and quite frankly, this is an old policy, and we don't know the history of it. We don't know why it was originally put forth, but it certainly doesn't specifically fit in with how we're handling our patient financial processing. So we think we need to pull it out.
Okay, but I can give you a history of why it's in there. I'm not saying I disagree with removing it, but we used to have a doctor on staff who had the patients from out of the area, and we didn't get paid on them. And he always brought the ones that we didn't get paid on to Seneca and operated, and the other ones he took to Banner. And so we passed a policy stating that we don't have to take out of the area elective procedures because a doctor was doing it intentionally. I don't need to.
Right.
Rich probably remembers who it was, but
Yeah.
that was the reasoning behind it.
Okay. So the way we handle that, or the way that we're trying to handle that, is that before we do an elective procedure, such, I'm guessing it's surgery, a surgical procedure, we put them through a financial counseling screening, we check eligibility, and we determine that whether or not that we're going to get paid for the service. And if the patient does not appear to have a financial support or a third-party payer, then they have to make a financial commitment until we'll schedule the procedure. So
Yeah,
that is,
that's fine. That's fine by me. I'm not disagreeing with what you're doing. I just wanted to know the rationale behind it. Now you know
Okay.
the reason why it was implemented in the first place.
right.
That's all.
Okay, appreciate that, and that makes perfect sense. But we think that we're catching that with what we're doing now. So
Steve, is there a policy that speaks to what you just noted?
that's a good question. I think it may not be a policy, but it's more in the procedures on how we do things. But as we're going through the Cerner process, we're documenting how we're going to do things such as scheduling and eligibility verification. So I'm going to have that added in.
Okay, just that, I just didn't want you to be subject to some review that says, where's your policy on this? So,
Well, we do conduct pre-authorizations, so that's part of, it's a procedure, doing pre-authorization for certain procedures. So insurance companies will let us know up front whether or not there's even going to be, there's any financial liability there at all. So rather than a policy, it's just procedurally part of what we do can, prior to the study or the procedure being accomplished.
okay, thank you.
All right, any other questions, comments, concerns? Okay, then I will accept a motion to rescind Finance 008.002.
So move.
Thank you, Dr. Walls. Do I have a second?
Exclude.
Second.
Thank you, Rich. All in favor, Ryan?
Aye.
Rich?
Aye.
Ken?
Aye.
Dr. Walls?
Aye.
Thank you. I'll vote aye. All right, moving right along. Number 10 is our 2023 regular board meeting calendar. Usually we look at this in December, but we can look at this now. I don't foresee any challenges from briefly glancing at this. Anyone else have any issues with this calendar? No? Okay. Then I will accept a motion to approve the 2023 regular board meeting calendar.
I'll move.
Thank you, Ken. Do I have a second?
Second.
Thank you, Rich. All in favor, Ryan?
Aye.
Rich?
Aye.
Ken?
Aye.
Dr. Walls?
Aye.
And I'll vote aye. Thank you. Okay, next up is the California Department of Healthcare Services Behavioral Health Continuum Infrastructure Program pre-application. So I don't know, hopefully board members had a chance to kind of at least briefly review this. What this is a grant that the state is providing to provide additional assistance to counties and local communities with behavioral health services. And what this specifically can do is pay to retrofit existing facilities to make them ADA compliant and whatever else is needed to convert them into such a facility. And so the total amount that they are actually allocating is $480 million across the state. They've designated $16 million for sprinkling of all the rural counties, including our own, but they also have 91 million in discretionary funding that they can allocate wherever they want. And so I wanted to talk with the board to find out whether we are interested in at least investigating this further and going through the pre-application process. What that means is we provide some just basic information about our facilities so they can see if we even qualify, which it looks like we would. And then we have a consultation set up where there's a dialogue with some contractors that they have put together to help assist us in an application process. And so we need to, if we're going to do this, we have to start the pre-application process as soon as possible because the consultation has to be scheduled by December 27th. Applications are due January 17th, and in the spring awards are announced. So it's a very quick, tight timeline. They do require a 10% match that can be in the form of funds or it can also be in the form of real property, which I imagine is probably how ours would be. We have to show community commitment, and any funds awarded must be fully expended by June of 2027. So with that, I will open it up for discussion, conversation.
I didn't
Input.
see in here, does this have to be applied for by the county or can parts
No,
of the
we
county?
can.
We can do it independently of.
That's
the
my
county.
understanding. That's part of the whole pre-application consultation. We'll ask all of those
Okay.
questions. Yeah.
Well, I don't see what do we have to lose by starting the process other than
That's,
time, your time
None.
probably.
None. Which I've got no problem, you know, just.
Well, you're done campaigning. and then you
Well,
get another
never
job.
campaign. Never campaign. So does the board have the context behind why we're chasing this? Does the whole board?
I don't.
um,
I don't.
I think,
If
I think some
you-
context is really important here.
I
So
agree,
there-
John. I just, yeah,
There's been a lot of
we've
questions. There's
talked
been a lot
about
of
this in
questions.
the past. So,
Yeah.
yeah, please give us an overview.
Okay, so there's been a lot of questions about what is going to happen now that we're on the track to the new facility. What's going to happen to the old hospital? And we've been noodling on repurposing the building for several different things. One of the biggest ones, because we do not have a dedicated inpatient behavioral health center in Plymouth County, period. We have, some housing, things like that, but this is, we don't have really anything to support that in the county. So we're thinking that since it can't really be a hospital, it cannot be an OSHPD 1 level hospital, but it can be OSHPD 4. It qualifies for that. So perhaps we repurpose this as an inpatient and outpatient behavioral health center that can be used by the county or in relationship or partnership, some sort of a joint venture or public-private partnership. How it's defined is to be determined. But it's certainly, we would like to create this application to do a feasibility, whether or not that building, we can turn it into an OSHPD 4 behavioral health center. There's some other thoughts there as well, but a good portion of it would be to support behavioral health services of the county. So you want to add to that at all, Jerry?
just to be clear that, converting it into OSHPD level 4 is a much less extensive
Much
process
less.
than if we were to have gone ahead and tried to convert it to OSHPD level 1 and 2. So
Yeah,
I just want to make sure that's perfectly clear too.
Yeah, we look, as part of the whole, strategic planning for the campus, we did look at at taking that to an OSHPD 1 level capable of supporting Senate Bill 1953. That was just not feasible. But it can be a lower level OSHPD 4. And I think with a lot less disruption. So a lot less cost. So we'd like to go that direction, and this will be the first starting point. See if we get money to help us out with that.
Ken, do you have anything? Oh, sorry, Dr. Wells.
No, that's okay. When we first were negotiating with Collins Pine about that land, there was some talk about Collins wanting the building.
There was? Okay.
Wasn't there some
I
talk?
don't recall that.
Okay,
I may
okay, but
not
that's
have
off the
been
table anyway.
I
Because
had,
it's a done deal now.
this is a done deal,
Yeah.
yeah.
Okay.
So, once again, it's a usable building, just not for a hospital.
Right. Do you have anything to add from the behavioral health perspective?
I'm sorry, Jerry, can you repeat that?
Yeah, do you have anything to add kind of about the needs for something like this within this, like we were talking about, you and I were discussing there being a
Yeah.
need beyond our county.
Well, clearly we would have to at some point do a needs assessment here, and that would run across counties in the region, I think, to better support the whole concept. There isn't a hospital within Plumas County. There's not one within Lassen County, Modoc County, Sierra County. So you may be able to generate some regional support to respond to the other counties' needs on this. I think it's been a frustration in Plumas County for many years, especially in the winter months when you have to transport people to the Bay Area in some cases for a psychiatric bed space. So it's much needed. We just have to be able to support it with some numbers.
Any other questions or comments around this? Rich or Brian?
No, I don't see any harm in doing a feasibility study. What is there a downside that the community might be concerned about?
Maybe some NIMBY issues, but I don't think there would be too significant.
Can you say that again, Ken?
There might be some NIMBY issues, not in my backyard issues.
Oh,
Oh, not in my backyard. Okay.
yeah, I was thinking that because.
Yeah. Do we think that might be significant, Ken?
I wouldn't think so, because this is a facility that's designed for short-term stays and some outpatient services, I would imagine. So the short-term stays, we might have people coming in for exactly that, a short-term stay until they're stabilized and then return to their county of residence or their town of residence. Outpatient services, I think, would just be pretty much Plumas County.
Mhm.
And when we were talking with folks, and educating them about the campaign for the new hospital, we also were talking about this being a possible use of the facility. And I don't know what other feedback you received, but everyone I spoke to was favorable with the idea.
Yeah, I think in general, I would agree. In general, people say this is much needed. It was not in my backyard, NIMBY, yeah, I'm gonna remember that. But it was recognition from a lot of the folks that we talked to that we really need this in Plumas County. That when people are in crisis and they have to go miles away, cities away, counties away, it's really a disruption to the family and stuff.
Well, then they're held in the emergency room department for sometimes days on end until the bed is secured.
Exactly. A big part of this is some relief to the emergency rooms within the county. Now, obviously, Portola is a long ways away, but from Chester, but having a place that you can house somebody in the county temporarily and then relieve the emergency department from having to do that is something that we certainly need to explore.
And what is the expected financial impact?
For us,
Yes.
well, hopefully none, because except for having a 10% stake, which would be the property. Part of this process, this application process, we'll be putting together a budget that they will be looking at and to see if they
Okay,
wanna-
does none mean that we break even?
Well, now you're talking about operationally later on. That's a whole nother subject that we have to delve into as well. Ken and I also discussed that, and he was gonna look at trying to get us numbers for 5150 holds across the 3 different counties, so we can kind of get an idea of what needs might be there. And then we're gonna try and get a hold of some other facilities and see what their operational spend looks like.
So that's part of our feasibility study?
That's part of this next process as we go
Yeah.
going forward, right? Yeah.
Okay.
Yeah, I would definitely bring all that information, along with, whatever our application is, if it seems like it makes sense to move forward with it, to the full board for reviewing all of that before we ever submitted the actual application.
Yeah, and Aspen Street, our architects, as part of the due diligence, we're looking at our campus strategic planning. They know the building very, very well. So I imagine they could probably spitball some pretty good numbers as pertains to moving to an Oshkosh 4 level building versus an Oshkosh 1. I imagine they have cost per square footage, so they could probably give us a good idea of what the actual renovation would look like financially. We would have to have entirely different operational pro forma on the backside of that, though.
Does that help
This is
answer?
reviewing it. I'm sorry, Gary, go ahead.
It's okay, go ahead, Ken.
I was just going to say, in just the initial reviews of the RFA, it looks like there's significant amounts of money floating around out there for this purpose. So I don't think the initial cost to us is going to be very much.
That's the whole idea, is to offset the cost to us, so to try to make it net zero for the renovation,
Right,
for the use, for the building.
for the use of
Yeah.
it. Any other questions, comments? Does anyone feel up for making a motion to move forward with the pre-application?
So moved.
Or, no. I'll second it.
Okay, thank you, Rich, and thank you for seconding Dr. Wallace. All in favor, Ken,
Hey,
Ryan,
Aye.
Dr. Wallace,
Aye.
Rich,
Aye.
and I'll vote aye. Thank you very much for that. We will get right on it, and Ken is going to be helping me in large measure with that. Thank you, Ken, in advance. All right, next we have number 12 is the MOU with Collins Pine for the heliport flight path. I didn't have any questions on this. Does anyone, any of the board members have any questions or comments?
Just, no, some of the language was a little strange to me.
The legalese of it?
Yeah.
All right, I will entertain a motion to approve the MOU with Collins Pine for the heliport flight path.
I'll make that motion.
Thank you, Dr. Walls. Do I have a second?
I'll second.
Thank you, Ken. All in favor? Rich?
Aye.
Ken?
Aye.
Ryan?
Aye.
Dr. Walls?
Aye.
And I'll vote aye. Thank you. All right, that moves us into the September 2022 financial report. Steve,
Yep.
take it away.
Hello. So before I go into the financial report, I wanted to talk about a couple things in the finance department, what's been going on. November was quite the month for us. So the first thing is that as part of the Cerner implementation, we are adopting or implementing a new financial accounting system, and the vendor or the system is called MultiView, and MultiView will host our accounts payable and general ledger and financial reporting information. The patient accounting information will live in Cerner, but will come across to MultiView to produce the financial statements beginning in May. We did go live today with MultiView, and I wanted to thank Kristen Courtright, our new accounting supervisor, and Janelle Hardig, our payroll and accounts payable staff individual, for their hard work with getting us to this point, and looking forward to a successful utilization of MultiView. We'll do our first check run next Thursday, the 6th, so next Tuesday. We've had to get new checks with MultiView, and there was a lot to it. So again, thanks to Kristen and Janelle. On the revenue cycle side, as I mentioned, Cerner has a huge impact on patient accounting and finance. And we had our initial meetings over the in the middle of November here, over a week. Some of them rolled into the next week, and now we've started our individual meetings to keep moving forward. Relating to patient accounting, there's 4 different meetings that we attend. Sarah Lynn has been instrumental in getting us through some of this, and riding herd on the many meetings and duties and responsibilities. And Sherry Castle also has been an integral part of the charge services portion of these meetings. Those will continue till we go into, Brian Churchill will give you specific dates, but those are going to continue going forward. The other item is that as part of the transition to Cerner, we're undergoing a full review of our charge description master, also known as the CDM. It's where our, as it sounds like it, it's where our prices for services and the charges are generated. So we're looking at that to make sure that everything is as it should be from a compliance standpoint. We have no reason to believe it's not. We look at it on a regular basis, but this time we're able to do a real deep look at it. We're also going to be looking at our pricing as far as competitive pricing, where we're in relation to our fellow hospitals in the area. Don't really want to call them competitors, but that's what they are, I guess. And then let's see, what are we? Oh, the other thing is that, and this is kind of an overlap with Cerner, that we're looking at our pricing methodology for both pharmacy and supplies that we can bill for. So it's a deep look at how we charge for services, and we're fortunate to have a good partner in this, a company called Para, P-A-R-A, and they are also going to get us to compliance with the price transparency rules. There's a report in the compliance report from there's a section in the compliance report from Charlene Almocera about price transparency. We have engaged Para and we've submitted all of our data. Sarah and I had a meeting with Para this week, and the actual price transparency functionality is about ready to go, and we'll have it on our website for by the end of the month, first of the year. What price transparency really is, it allows a consumer, talking about elective procedures at a hospital, it allows a consumer to go to a hospital's website and say, I want to have a colonoscopy, and they can click on it and put in colonoscopy, and not only will it tell them what we charge, but based upon us being able to put, and it theoretically can give them a calculation of what the discounted charge is, and we'll see if about determining the patient responsibility, because that goes to the plan information, and that's a bigger challenge. But it allows for some competitive shopping, which really doesn't come up with us quite often, but it's just a nice thing to have should a patient come in and want to know that what it's going to cost me. And the other thing it'll be used for is when Medicare beneficiaries come in, there are some things that are non-covered by Medicare for whatever reason. It's not medically necessary. And we issue what's called an ABN, an advanced beneficiary notice, and it tells the patient that there's a possibility Medicare won't pay for this, and therefore, you have three choices. Just walk away. You can say, I'll pay it, and I don't know what the third one is, but it's basically they say, yes, I will I'll take the service with knowing that there's a risk that I'll be responsible, but then we're required to give them an estimate of what the cost may be for that service. So that will help that process as well.
So Steve, I can ask a question really quick about the price transparency.
Uh-huh.
So I think right now we have a spreadsheet available right now, right? So will we be able to provide a better format for people, you think, once we get through this process?
Yeah.
I think you're breaking up.
Yeah, we're required by the state to put on the website, and the Para transparency will cover it. And the thing about it is that charge master is posted once a year, and I guess you need to update it as it goes on there, but this will give them the same information that they're currently getting. So it's going to be a one-stop shopping, I guess.
It'll be easier to digest than having to dig through the spreadsheet.
Yeah, like, and then the individual that came to the hospital one time and said, I don't have a computer, and we printed out 900 pages or whatever it was.
Yeah, that's where I was getting
Binder.
at too. Thank you.
Yeah, so, but we will be able to make that information available to everyone, including the people that don't have computers, but it will print it out and it'll say, here's the summary, and not the whole darn charge master. So, okay, the couple more items. One is we just filed the fiscal year ending 6/30/2020 Medicare cost report. Deadline was yesterday. It was filed prior to that. We are wrapping up the audit for the same period, and the plan is to present that audit to you all at the December 29 meeting. Last thing is we've been talking about investments, and so we've done some looking into what we can and cannot do, and what we're being told is there's a lot we can't do. And we spoke with Edward Jones, we spoke with Plumas Bank, and we also spoke with our municipal advisors, Fieldman Rollap. And it's in California, a municipal or a public entity cannot have their investments held by an outside third party. The only places that they can put those investments or have those investments is with the LAIF fund, and there's a county city fund that's similar to LAIF. What we're looking at and we're trying to get some guidance on is what can we do ourselves, and if we can do the investments ourselves, such as Rich has suggested, of trying to get in purchase treasuries through Treasury Direct to create appropriate checks and balances and controls over those funds. So that's
Good,
where we're at with that. Fieldman Rollap will be here next week to meet with the USD, and we also need to create the bond funds that we receive from the tax initiative that hopefully is finalized in the next week. So that's kind of the update on finance before I go into the September. Any questions or comments about all that? Thank you for the indulgence on that. It's just a lot been going on. And yeah. Okay, so September. And again, September is, we're still 1 month behind where we should be on presenting. I should be presenting October to you right now. You know, I always say I don't see any reason that we can't get current in the next month, but I really don't. We've ticked off a lot of these things here that are incredibly time consuming. So that is the plan. And then there's also an additional incentive to become current through, it would be through November. So October and November presented at the next board meeting, because December will be presented through multi-view as opposed to evidence. So you guys won't really see that. The report's going to be the same. The presentation will be the same, but we'll be processing in multi-view. So I want to be closed out of evident when we go into multi-view. So September was an interesting month for us. As reflected here, we had a net loss. Hang on a second. We had a net loss of $228,525 versus a budgeted loss of $459,758 for a positive variance of just over $231,000. This was really driven out of patient revenue, and it was driven out of patient revenue in both areas, inpatient and outpatient services. we had acute med-surg inpatient days, we had swing bed days, and then of course the long-term care. The swing bed and long-term care were right about the budgeted census, but acute was above the budget amount. And between acute and swing, we budgeted about a 1.5 average daily census, and we were at 2 for the month. So a couple of things there is that there is a demand for services in our community, and it doesn't sound like much too, but that is a demand. That's two people on the floor in our hospital every day of the month. So and it shows that we can handle that level of patient utilization. We budgeted for 1.5, we achieved 2, and it was not a disruption to our staffing and ability to care for patients. The outpatient revenue was well above budget, just over $266,000, and it was across all areas. September was the first month of having Dr. Backham here, so we had been working strictly with Dr. Walls, Dr. Ware in the walk-in clinic, and Dr. Backham filled a third provider office, scheduled provider office. In September, she saw 176 patients, and in October, she saw just over 200. So again, it's demonstrating there's this demand in the community, and it's reflective in our numbers. So the ER was still busy, wasn't like it had been previously, where that was one of the options for patients to go until we had another provider office available. And it was slightly above the budgeted utilization and revenue. So this is a good story. This just shows how close we are to being able to significantly impact our financial operations in a positive manner. It's kind of a silly statement, but providers. So I was talking with Sean and Judy, and when we interviewed the candidate for the clinic operations position, as we were speaking, Sarah Lynn and I met with her. When we were speaking with her, we just said, the good news is that the demand is here. And so it's not like we have to go create demand from some other source. We know that with the numbers that we've seen from the various sources, whether it's Whitley or our actual financials or historical financials, that there's a sufficient demand in this community where we can support the kind of financial operations and results that we're looking for. The adjustments to revenue were right in line with budget, as was the other operating revenue. The good story being told is in all of this, our expenses are being managed very well. September was the month when we had finished the CNA program, and the students had accepted the positions and were working on the floor. So our salaries and wages and our contract labor were very much in line with budget. Professional fees medical, this is a direct impact of the use of locums providers, both in the emergency department and Dr. Backham, where the simple reality is we have to pay more money for contracted temporary physicians through an agency than we do for bringing in our own providers. So kind of simple math there. Again, everything else fell in line, and that's our operations for the month. So it was a good month, and it was a month that shows us what can be. So questions or comments?
Steve, do you have a kind of a feeling for what the October report is going to look like?
I should, but I don't.
Okay, that's fine. I just didn't know if it was gonna be kind of the same sort of trajectory as September.
Well, the only thing I've seen is, again, is I've seen the utilization in the clinic, and it's very similar. It's very similar to September. What I don't know specifically is there also the continued utilization of the hospital for diagnostic services and those types of things.
Fair enough, thank you.
Sean, do you have a sense whether October and November are the same or better or worse?
I think October is going to be a little better than September, slightly. I think it's going to be reflective of a good outpatient, good ambulatory, good use of diagnostics. The hospital, looking at the daily, it looks like, yeah, I think it's going to be pretty close.
Okay, thank
Any
you.
any other questions or comments?
I was just trying to remember when we had our first snowstorm. Was that in October or a little later in November?
November 1st.
Okay.
All right, thank you, Steve.
Yeah, right after Bailey Creek closed.
Sure.
You broke up, Steve. Did you say it looks like it's probably going to be close, October?
No, I said I was golfing the last day of October, Bailey Creek, and then 2 days later it was covered in snow.
Yeah, exactly.
All
Early
right,
winter, good stuff.
thank you. With that, I will accept a motion to accept the September 2022 financial report.
So moved.
Thank you, Dr. Walls. Do I have a second?
Second,
Thank you, Rich. All in favor, Dr. Walls?
Aye.
Ken?
Aye.
Rich?
aye.
Ryan?
Aye.
And I'll vote aye. Thank you very much for that, Steve.
Good report, Steve. Thank you.
All right, so now we have the AB 361 Brown Act Amendment. Do we have any changes to this? Sean?
I don't think so. I think that, you know, with the combination of RSV and influenza and COVID, I think we just need to continue what we're doing.
Okay.
Provide a hybrid option. We are going to be there. So the public health emergency is ending.
At the end of February, right?
Right. So we'll see what happens with the requirements for 361, but I'll be tracking that to see if there's any changes in this requirement.
Okay, thank you. I would like to continue recording and hosting it virtually, even if it means all the board members have to be back here.
Yeah,
Based on whatever changes.
I think, you know, I think it's a good idea. I think that folks want the option.
Great, thank you. All right, next up, number 15, preliminary results of the November 8th election measure B. Now, it's not official yet, because the board of supervisors still has to ratify it on December 6th, correct?
Correct.
Yes, but the unofficial final results, the community really came out and supported what we're doing. Almost an 80% approval, which is amazing. So
That is.
thank you to the community and to all of our staff who worked so hard on this. And I don't know, Sean, if you have anything you want to add.
To me, I see this as our community providing us a gift of trust. We are definitely on a journey at Seneca and things are changing. I think that there's recognition there. We just need to continue to improve and look to providing care to our community with the new building for generations to come. So I'm very, very pleased with the outcome. I'm really amazed with the number of people that came out and voted.
Yeah.
That number was very high for what we've seen in the past. I think that the voter numbers were very high. So good, you know, generated a lot of interest. I'm sure there were other things on the ballot as well that were of interest, but this one, I couldn't be more pleased. It was an effort of everybody. So
We had a major storm that day too.
We did have a major storm that day
Yes, we
too, you're right. Board members, any other comments? No? All right, well, we will be thanking our community. We are planning some things right now, but.
Yeah,
to
waiting for
determine.
December 6th.
Yes, we have to wait till it's officially final and everything's all signed and crossed, T's crossed and I's dotted. But more to come there. All right, so next up is vacancy in office. Sadly, Dr. Walls decided he decided not to run this year for the seat. And we are very, very happy that we had you, Dr. Walls, while we did, because your input and your insight has been invaluable. Very, very grateful to have had you on our board, and I hope you continue to stay engaged and let us know if there's anything that we need to address that we don't know about.
I wanted to comment on one thing here, though.
Sure.
It was on the, I think this is item J. I don't know if that's a standard form you get from the county or what. It says to fill the vacancy of Dr. David Walls, and underneath it says name of resigning member.
Yeah,
I
you're
don't
not
like the
resigning.
term resign because I was elected to a 4-year term. I served the 4 years. During those 4 years, I only missed 2 meetings, and one of those was a special meeting that was called while I had a medical procedure being done.
Mhm.
So I didn't really resign.
No, you didn't. And I think this was a standard form that was pulled up. So can we maybe make that change?
Well, I don't care about
Actually-
making a change. I just
No,
want to make people understand.
You
I
didn't resign.
Yeah, well, yes.
Yeah,
It's a
actually,
standard form.
he did mention that at the last meeting, just in passing. And so I contacted the elections office and we must utilize the form that they have provided.
Oh,
That's
really?
fine.
Okay. All right, well, but yes, to your point, you're not resigning, you filled your full term, and we are very grateful for that. So thank you, Dr. Walls, very much.
Indeed, thank you, Dr. Walls.
Tomorrow, yeah, so this notice is gonna get posted tomorrow. And we will be hopefully getting letters of interest from community members who want to maybe fill this position ahead of our next board meeting, and then we'll have them here for interviews. And as long as my timing is right, I think we have either to select at this upcoming meeting in December, or if we don't have, make a choice then, I think we have January's meeting as well.
Yes.
Based on
You have
timing.
60 days.
Yeah, so hopefully we'll have someone at our next meeting, but just in case we don't yet, then we do have still January's meeting. So do you have anything else you want to add, Dr. Walls?
No, just make sure people understand I'm resigning for personal reasons that I can't control. Let's put it that way.
And again, we really do appreciate
Because
it.
I've enjoyed it and I would continue doing it if my health was better.
Well, maybe at some point you'll come back. All right, thank you.
I've got another quick question.
Sure.
Because you have fulfilled your full term, is the board planning on appointing someone else or having an election that anybody that wants to apply can apply to be elected?
I think the intent would be to appoint someone until the next general election. And then at that point, I think it's when the position will come up for election. Because otherwise we have to bear the cost of an election ourselves.
So if you appoint someone, do they fill out a 4-year term or do they fill, like you said, till 2 years?
2.
Mhm. Yeah, they'll fill 2 years and then the position will be up for election. So, all right, so that takes us past special vacancy notice as well. So next up is the HRG report. Steve, are you still on?
Yeah. Yeah. So, yeah. So, just real quick here. We
Steve,
did
you're really
see
breaking up.
the ARAs go up 57.7.
Hey, Steve, we're having a really hard time. You're breaking up pretty badly.
Just
You
put-
want me-
It's just out of our best
I don't know if you can hear me.
practice for 45, 50. It's really related to a couple accounts. As always, when we, with the long-term care, it's just to continue. Yes, hello?
We can hear you now.
Okay, can you hear me now?
Yes.
Yes.
Okay, I'll talk slower as well. So the days did go up, and it was really related to a couple long-term care accounts that we've been struggling with, and that's nothing new. We appear to have them resolved as of November, and so those will take care of themselves by the end of December, well, this month. And we also had a large inpatient that went to swing that we've also that was hanging out there. So we just have those accounts that sometimes do this, and we'll see the numbers go back down. Not in November, but in December, we'll see them come back down to where we want to be, in the middle of that range. Hey, I did take a look at October, and the good news is the outpatient remained pretty much in line where we were for September, almost 1.8 million. So that's a really good thing. The inpatient, however, dropped, and there's just really not a lot we can do with that. So the total revenue for October is going to be about 2.17 million versus the 2.4. But the outpatient was good, so that's good news. And that's my report.
Great, thank you, Steve. Anyone have any questions or comments on the HRG report? All right, moving right along. Item 19, the critical access hospital report. Donna, are you on?
I am.
Hi.
Hi. All righty. So, diving into the report for the critical access hospital, I'll just go through the provided document. Contrary to what I had in our last report for the October meeting, I had in writing indicated that the CEQA-NEPA field work was complete. I had verbally clarified that, but wanted to, in writing, clarify that here today, that that was a misstatement, and they were still in the process of doing one last portion of that. That now is complete as of yesterday, rather. They were able to move some things around on their schedule such that they completed the work before the snow came, which was a big push, obviously, so that we didn't miss that window.
I was gonna say they barely made it.
What's that?
They barely made it. There's a whole bunch of snow.
Yeah, I'm grateful that they were able to push that ahead for sure. So we'll be getting those reports from them, and I don't believe I'll have a much more to report at the December 29th meeting, but definitely for January, we'll be able to provide where we stand with that CEQA analysis, and we'll have a draft initial study at that point for sure. Moving on to Heliport, the draft MOU that you just approved for us to bring to Collins Pine for their review. We'll work to get that their input on that, and then ultimately we'll be bringing once we get everything approved through the FAA and Department of Aeronautics, that's when we would bring back an actual easement to the board for their as well as Collins Pines review. So that's where that stands. No update on the harvest plan, no update on the Wildwood easement, and no update on LAFCO. As you had as had been previously reported to you in this meeting, with Measure B passing with 79% approval, we are, and as Steve referenced in his report, we are working with the financial advisors for the timing of those bond issuances, potentially issuances, as it relates to the project schedule and as it relates to the USDA financing. So trying to get all those ducks in a row for the financing for the project.
And Donna, sorry, Donna, we're gonna probably talk with the USDA about that as well when they come out next week, correct?
Correct. And I did get a reply from the USDA representative today. He just replied to me saying that he thinks that he's going to be able to, that he's pretty sure we'll be able to have that finance meeting following our site walk.
Okay.
So not 100%, but it's sounding like it's 95% sure we're able to have that meeting. And that's to go over the overall picture of with the bond passing and USDA DA financing and how that big picture of the overall project funding is going to look. For USDA, as you stated, they'll be out on the 6th to do a site walk, followed by that financial meeting. We're working on getting some questions answered to them for the pre-application and are hopeful that soon thereafter we will be getting their formal response to our pre-application for the USDA financing. For other funding, we're looking at philanthropy. We're talking with LaMalfa's office regarding federal earmarks, and we're still looking to hear back on Senate Bill 395 for any funding that could come from that once that sin tax is evaluated and determined how much is going to go to each of the applicants for that Senate Bill 395. Schedule and budget, I am asking that we have the time, and I'll go over what this means here in this next category of design, but have some time through the validation phase of the design. Tell you what, I'm going to pop down to design and then I'll pop back up to schedule and budget. So on design, we fully contracted with Bolt, the Bolt company for their work as the design build entity, with HGA under them as the architect. We issued the notice to proceed for that, such that 45-day validation phase started on Monday, the 28th of November, and is scheduled to complete January 12th of 2023. During this time, the design build entity will be working with the staff, with Seneca Healthcare staff, to get the project budget, schedule, scope all aligned, such that when that January 12th date hits, we'll be moving full forward we'll be able to give them direction to move full forward into the design development of the drawings, and then subsequent to that, full document development and permit followed by construction. So while why I'm going to pop back up to schedule and budget with that is that with that 45-day validation phase, again, they are going to be validating that budget, schedule, and scope. And therefore, after that validation phase, I'll be reporting back to the board with the final information from the design build entity on those. Nothing new on the medical equipment planner, other than we've notified them that we're moving forward with that we've contracted with Bolt, so they've been notified and they'll be ready to hop right back in and provide their feedback along with the design build entity, so that we're moving both of those contracts ahead in parallel. And with that, I open up to questions.
Thank you, Donna. Anyone have any questions for Donna? Questions, comments? Rich and I are pretty familiar with all of this since we participate in the meetings every other week, actually. So, but I don't know if the other board members have any other comments or questions on it.
I don't have any.
All
No
right,
questions.
Okay, thank you, Ryan. All right, thank you very much, Donna. Appreciate it.
Thank you.
All right. Sean, you're up. CEO report.
Okay, so monthly updates. So the new hospital build effort, I can suffice to say that we have moved from one milestone to the next. So I gotta tell you that 80% on Measure, almost 80% on Measure B was a vote of confidence, and I want to thank the community and members of the staff and the board for really putting forth a huge effort for really the last 2 years to make this happen. So we're moving now into a different milestone, which is the validation period for the building. And like Donna, I don't want to reiterate everything she said, but the next 9 months, or roughly the next, I'd say 8 months, are going to be very, very busy in getting CEQA and NEPA completed and everything ready so that we can dig dirt sometime. Date to be determined, but preferably sometime midsummer of 2023. That's kind of where we're shooting for. But things can happen. But we've got some due diligence to complete, and then we're moving into the milestone where we start digging dirt and putting up the superstructure, and the community will actually be able to see activity. So right now it's all pretty much behind the scenes, important work, but behind the scenes. So we're on to the next milestone, on to the next phase. So appreciate everybody's very, very hard work and the community's trust. Dr. David Walls, I'd like to thank you personally for your tenure on the board and for your insight as a practicing physician. I think that it brings a different perspective to the board of directors when you have a practicing physician on the board. So thank you from me for your tenured excellent work on the board. And continued work. What's that?
You're certainly welcome.
Okay. Moving on, legislative updates. The California legislature has been out of session since August, so they will resume in January. I suspect there's several bills that we really need to be tracking. I'm working with our advocacy groups and our CHA and some others that are really tracking some very impactful legislation that could happen. So we'll be tracking that.
Negative impact.
Not good. It's not.
Well, let's hope they don't pass.
It's not good. Healthcare continues to be under duress from whether it's reimbursements to labor to different things that are starting to happen. And it's just, we'll see. But there's legislative updates that'll come fast and furious when they go back in session. Some campus upgrades. So the security camera, we've been talking that for a long time. We have the VM environment for the long-term storage, and it's pending. They'll be going forward up. Radiology transfer technology will also be going in now that our environment is solid. We are dealing with some things in our technology environment that take precedent over these things. The Cerner implementation, the voice over IP system, the new system. So those are all going forward. I don't need to beat those up. Brian Churchill, if he's on, will go over a little bit more about the Cerner implementation, but it's tracking fine. Seneca voice over IP system implementation is tracking well. That'll happen. Physician and mid-level recruitment, Dr. Russo, as of next Monday, will be replacing Dr. Baucom. I had a conversation with Dr. Baucom. She was outstanding, and we really appreciated her being here as a locum for our primary care. Dr. Russo will be taking her place. He's under a 3-month contract with the possibility of extension. So we've got that. We continue to beat every bush that we can for our full-time, long-term staff. And recruitment in that regard will continue. We're just never going to stop till we're there. I forgot to put Clay's last name in here, but we've added some per diem mid-level providers for the walk-in, Bob Kurtz and Clay. They're rotating in and out, and they're outstanding, all of them. Other than that, Seneca campus upgrades, I added one to the completed project. It's underlined at the very bottom, the Generac generator installed for the education building. It's not yet hooked up, but it's on site, it's in place. So I put that into the completed projects. So we're getting more completed than we are, keep adding to the completed list.
And then we'll start adding new projects underway.
Yeah. Well, the current campus, we're going to slow down on the projects on the current campus and really turn our attention to the new building. That's all my report. Any questions?
Oh, I just wanted to say I actually had the opportunity to visit the walk-in clinic about a month ago, maybe. And it was very nice. It was a very nice experience. It was very open, very clean. The staff were extremely welcoming, and I just wanted to make that shout out because I really appreciated that. And they didn't know who I was. I was there with my son. They had no idea, but I saw them treating everyone that way too. So
Great,
I
good
just
to
want to
hear.
say thank you.
Good to hear. That will be a continued push.
Okay, thank you very much, Sean.
Mhm.
All right, so next up we have Judy's CNO report. Is she with us? or-
She's remote today, I believe, Judy?
I'm here.
Hi, Judy.
Hello. I'll try and keep it pretty brief, giving you the usual stuff on COVID. It felt like we were experiencing a surge there for a bit, but it's calming down. What we're seeing is RSV and influenza A mostly. I hope you can hear me okay. I have limited connectivity.
We can hear you fine.
Fantastic. So what we've been focusing on, I've been working with Dr. Nielsen and Royce in our respiratory therapy department to look.
Uh-oh, we couldn't hear her.
We lose you? Hello?
At our pediatric readiness, looking at our protocols and our airway equipped sick infants coming in, and we actually had the opportunity to utilize our Panda warmer that we purchased last February, which came in handy for this very ill infant that we ended up shipping out to Stanford. We are doing our education on bronchiolitis and all things respiratory, and working on education in general for our staff. And I've listed it here, so I won't go on and on. If you don't have any questions for me, or if you do, I will take those now.
This all looks good to me. Thank you very much, Judy. Do any of the board members have questions or comments for Judy?
Nope. Thank you, Judy.
Can I just point out that we've been surveyed quite a bit, you know, that now the CDPH, now that COVID is lifting a little bit, is getting out and catching up on a lot of the stuff they did. And I have to tell you, and I'm going to hand it to Judy and her staff, we've just done really, really well on all of our inspections. So, you know, just very, very well. I mean, you don't expect things to go so well just looking, but outstanding results. So I'm handing it to Judy and the team for great work.
We have a great team here. I'm very proud to be a part of it. Thank you.
Thank you. Okay, thanks, Judy. We'll go move on to Cerner update, project manager report. Brian, are you on?
I am here. Good evening, everyone. So we had our big workflow and integration at the beginning of the month. And since then, weekly, bi-weekly meetings have been scheduled, like Steve talked about earlier. They're averaging about 15 meetings a week for the Seneca staff. So it is quite a commitment, as there are, you know, 3 to 8 people on each of those meetings. The staff is wonderful here, watching them absorb and see the pieces come together since workflow integration. The next big item coming up is right after the first of the year. It's called Train the Trainer, what will be giving access to the super users and subject matter experts, so they'll be able to be in the system. The basic build of the system, that all the data that we're collecting right now should be done at that point. It's a 2-week event. First week event is front door registration, clinical documentation, things of that nature. And then the following week will be for patient accounting, building, to test the information that was entered to make sure the charges were captured or flowing across, that bills are being created, that R1, who is the HRG replacement, will be able to process and the claims properly. So that is the 2 big events coming up at the beginning of January and at the end of January, working with Cerner to make sure who's coming on site that week of 1/4 to 1/6. With potential storms, we are, also making sure that we have contingency plans. If a storm happens to hit during travel days, there's not a lot of leeway because of the holiday at the beginning of the year. So we'll make sure that event happens no matter what. With that.
So sorry, Brian, so the Train the Trainer will happen here then on site?
Yes.
The majority of it will. There are some modules that won't be, like Steve Stoops, his will be remote, but the bulk of them will be on site. I'm going to get that from Ashley this afternoon or tomorrow morning to hand out to everybody. So that will help us establish the training spaces required for that event. How much space we actually need for each of those on-site events. We've been able to adjust the surgery schedule, so they won't be impacted by Thursday, which was a big push that I have to keep on reminding Cerner on, that, you know, that's Seneca's surgery day, and that's a hard day that can't be moved. But they've been accommodating in working through that. Data collection worksheets. The staff has been doing a great job collecting the data. It is a, you know, pulling data out of the old CPSI system is not easy. There's a lot of information that's not in CPSI that was paper, but the staff has been doing a great job working with the CERN team, collecting that information. And that's when we will see the fruits of that really at the end of January, the first week of February, when we're going through those integrated testing sessions. So between train the trainer and integrated testing, we'll be building kind of clinical scripts for the common type of patients that Seneca sees, to make sure that the critical workflows are going to be working properly, that we've collected all the data properly, that everything's working properly. And then we will take, you know, a few of those obscure visits that may only happen during the summertime to make sure that we are prepped and ready to go. So, you know, it is a monumental task for this facility to be doing this. Everybody, I am amazed at the level of acceptance and willingness to put in the time for this. You've got a great group of super users and subject matter experts there, really invested in to make sure this happens properly.
Yeah.
Thank you, Brian.
Can I just add that, you know, I've done many implementations in electronic health record, and generally larger organizations have people sort of on the sidelines that are able to do this. Everybody here has a job. So this is working long hours and doing those DCWs, data collection worksheets. And I just want to hand props to Brian for pushing, but also to our staff for the extra mile that they're taking to get this pulled together.
Absolutely.
It's a lot of work. It's a lot of work.
It is a lot of work, and they're very accepting of doing it. They understand the meaning of this to the community. So it's great to see.
And hopefully this will make their job a lot easier too on the backside.
Yeah.
It definitely will. You know, initially it'll be tough because there won't be the data in the system. But once you get to the second visit, that's when life becomes a lot easier and you start seeing the benefits.
I think part of the motivation too is we've been working with a terrible system, and everybody's looking forward to not dealing with that terrible system anymore.
Yes.
No, I mean, really, I think
I
that
think
is
that's a huge part.
That is definitely a great motivator.
That's good. We appreciate all the staff's help with this and work on this. I am looking, I see you have some issues listed, Brian. Long-term care.
Yeah, Sean and I are working diligently with Cerner on long-term care. There are three components of long-term care. There's the documentation portion, there's the rev cycle portion, and there's the MDS portion. Cerner has the charting cycle set. I am working with my consulting group, and they're reaching out to everybody to see if we can find people who can help build the MDS in the building. It's something that we're going to have a risk analysis meeting within the next week or so. Both Sean and I are going to push hard on this. This is not something that I would like to see pushed, especially as you start going into the busy season in May. You got a new building coming up. The resources just aren't going to be there at Seneca for this. So we'll be pushing really hard to find creative solutions to try to get this going on time.
Okay, and so I guess I just, I don't know how this works. So they don't have a resource who's doing MDS in part of our other facility in the hospital or in the clinic who could.
No, it's only long-term care. It's a long-term care billing, and MDS is specific to long-term care. The rest of the modules are fully staffed inside of Cerner.
And I asked Cerner that very question when I spoke to their leadership to say, listen, you could teach somebody to become a subject matter expert for Cerner for long-term care in the amount of time, it's not that much of a divergence. Mm-hmm. And their answer to me was, we don't have anybody. We just don't have anybody. So, which was not acceptable to me. And Brian knows I've been a little bit grumpy Gus
Yeah.
with them. But we're going to find some resolve on this.
Yeah, and then, we've got some feelers out there, Cerner's, the elite group is pushing hard through their resources and their other Cerner folks. Pam used to be CIO at a Cerner hospital, so she's got a lot of Cerner contacts as well as I do. So we're really pushing to find resources and then force them down Cerner's throats.
I think the board needs to know too that part of my conversation is if you can't staff this, don't sell it to me.
Right, well, that's exactly what I'm thinking.
You
when
know,
I'm looking at
don't
this.
sell it if you can't put it together. And that's where I really wanted to put the rub on them, was just look, you're selling this as it's like ready to go, but you can't do anything with it. So there's the typical disconnect between the sales team and the project team.
Yeah,
right? Sell me everything, and the project team looks at you and goes, can't do that. So we're kind of in the middle of that right now. So.
Okay. All right. Well, thank you for that update, Brian. Appreciate it.
No problem.
Any other board members have any other questions? No? Okay, thank you, Brian.
Question, who is Pam? Who is Pam, and where was she CIO?
She was Pam is the president of the Elite Group's consulting firm. She was in Philadelphia. She was the CIO of the children's out there with Cerner Hospital.
CHOP. Okay. And
CHOP.
what's her name?
I'm sorry.
Pam
What?
yes.
What is her last name?
Saechow.
Okay,
Saechow.
Thank you.
All right, thank you. Any other questions? All right, thank you again, Brian. We'll move on to our departmental reports. We have compliance report. Went through this, and Steve talked about the hospital transparency piece that we're working on as we implement Cerner. Is there any, I don't think there's anything else in here we need to really focus on right now, is there? I don't think so. Okay. Thank you for that, Charlene, if you're listening. All right, next is IT informatics. No report, but I mean, we've got our Cerner update and everything else. I think we're pretty much on top of what's going on over there. HR, and we have a report from Jenny here, talks about our open positions, and then our staff newsletter, which again, I very much appreciate. I think this is very well done. And I appreciate everyone's input into this too. I like how you kind of weave in stories from different departments and everything, acknowledge anniversaries and all of that. I really like this a lot. I don't have any questions for HR. Does anyone, any of the board members?
Have you, has a decision been made for a clinic manager position or director or whatever that office is?
We made an offer today and we're just waiting for that.
All right. And then next we have the marketing PR report. Thank you for this report, Chelsea. I see we have our new phone number listed here. This will not be active though until we actually get the VoIP completely.
It's already active. It is
active.
It forwards.
Transferring to our hospital line. So we're starting to put it out and replace literature.
Okay. So that's probably something that we want to make sure everyone knows about, that our new phone number is going to be 1-833-CARE-SHD,
right,
which is 227-3742. So I like how it rhymes. It's cute.
And how long will the current numbers work?
We're going to have, I can't give you that answer right now because we found out that Frontier will in fact port their numbers. The whole idea was that they wouldn't port their numbers. Now they are willing to do that. So we're going back to
required by law to do that.
Well, it's really weird because they were adamant and now so we're going to be porting some numbers. Do we have an answer to that? I don't have an answer.
Hypothetically, if they're allowed to port the numbers, when someone calls one of the old numbers, it will transfer into the main line.
Into the main line, right.
So we are hoping to port them for at least a year, is what I
Right.
heard last.
So that people, if they call the old number, still get in. So we're gonna keep those, it's gonna be a call forwarding for a period of time until it kind of starts to settle in.
Great. And I see lots and lots of other marketing PR things on here, which is awesome. Anything you want to point out? Just in particular?
No, there's a lot going on, and
Sponsorship of the rink.
yep,
That
we
was
are,
decided.
that's a new one, we're sponsoring the ice skating rink.
Fabulous.
So we'll be sponsors for that, and then, yeah, just continuing all the marketing and increasing it every month so that we're doing a little more marketing in different avenues.
Thank you.
And sponsoring the rink, is that to generate more business?
We hope not.
We hope not, just awareness.
Was not the idea. But if you fall and bump your head, we'll put the 800 number right there.
I've been announcing that the rink was going to be open to all the groups I've been going to, and that was one of the questions. Oh, they're trying to generate this. So it's not an original idea.
All right, so any board members have any other questions or comments on any of the departmental reports?
Just a quick comment here. I thought I'd noticed on the marketing PR report that there would be some updates about the new build on the website.
Yes, so I'm currently updating new build information on the website. So it should be ready to go live anytime. I'm just waiting on the most current renderings and the most current website design. So they keep, as we go through schematic more and as we now have this contract with Bolt, things are going to change a little bit. So we haven't updated it yet because I want to wait till we get those changes.
So you'll probably wait until that 45-day
day.
period.
Yeah.
Right, yeah, that way you won't have to keep doing it.
Because then we should have an idea as we move through it, the validation period, it might change shape a little bit.
And then one of the major things that I'm updating to the website that I'm waiting for is updating all of the donors that have donated towards the new build. So that's something that should be going up soon.
I just think it's a good idea to keep the community updated as much as we can beyond just what happens at our board meetings. So, yeah.
So maybe something about the date for when
Yeah.
we will have more information? I don't know, maybe make it a week or two after our
Yeah, I can
validation date.
We can do that. I can put that on there right away that we'll add more information after this date.
Okay.
Yeah, and Chelsea and I have spoken about this. As we start to develop, especially when we start to dig, there's going to be lots and lots of updates. Once again, I've talked to her about putting out a webcam so that people can see the superstructure go up. And I think it's really important that the community sees things happening.
Right.
Yeah.
Right now, it's a lot of the, CEQA, NEPA gobbledygook that has to happen regulatory wise, that it's just really hard it's really hard it's not tangible. Right. But that's going to be a big thing for us, is making sure that the public sees where there's change.
Well, Sean, my meeting with you, that's the intent of the information I'm looking for.
Next steps.
Is to lay out a proposed sequence in a manner that the public can understand that these things, you don't get an approval today and do it tomorrow.
Exactly.
There's
Yeah.
certain things you have, and to explain that, I think will make it much more easy, and then you can fill in between those dates.
Yep. And I mean, once again, committing to certain dates, I won't do, but I will tell you the phases that we're looking at. And I might grab Donna to help me out too. She's our construction program manager.
It takes 60 days to get permits, you can put, it takes this many days, blah, blah, blah,
Without any hiccups.
It's,
Right.
and when you're dealing with the county,
They're so aware of what we're doing right now. It's kind of old for them now. They're like, okay, whatever.
Okay, and if there's no other questions on that, then we will adjourn to closed session. Take a 5-minute break. If anyone needs to stretch their legs.
Oh.
That could be specific.
That's true.
I'll call you if it happens.
Okay, thank you.
Doesn't necessarily need it, but is she online?
Shall we?
No. Can you just,
And Charlene possibly does.
well, Charlene should be available for questions because she's presented it directly to the board, but I mean, Sean said.
This meeting is being recorded.
All right, closed session is closed and open session is open. No reportable actions were taken during closed session. Our next regular board meeting will be December 29th at 3 p.m. here in the conference room. We will also be including on the agenda that we'll be interviewing candidates for our board vacancy, as well as doing our regular organizational meeting, deciding who's going to be board president, et cetera, et cetera. So with that, meeting is adjourned.
Thank you.
Thank you.
Thank you.